Hi, my name is Cheryl Roth, and this is my research presentation. My topic is, does high-intensity interval training help overweight and obese individuals lose weight faster than moderate-intensity endurance training? What I'm going to discuss here today is obesity as a health issue and its significance, not only on the individual but as a nation. The purpose of my study and my hypothesis, past literature dealing with high-intensity interval training and moderate-intensity endurance training, the methods and procedures of my study, and the limitations and delimitations of that, and then a summary of what we've discussed today. Okay, so obesity. The definition according to the body mass index, the BMI, which is a value calculated using height and weight, which we'll discuss later how we get that, is someone is obese if they have a BMI of greater than or equal to 30, and someone is overweight if they have a BMI of 25 to 29.9. Now, trends throughout the years. So since 1960, the obesity rates in the United States have basically tripled. In 1960, it was around 12 to 13%, and in 2010, it was 35.5%. So 1 out of every 3 people in the United States is obese, according to the BMI. When you include obese and overweight individuals, that number jumps to 69%. So more than 2/3 of U.S. Americans are obese and overweight. And just to put that into pounds, Americans are 24 pounds heavier today than they were in 1960. And for a visual representation, you can see that the obesity rates have increased slightly through 1980, and then they take a sharp increase up until 2010, and they're still climbing to right now it's about 35.5%. So why is this an issue? It's an issue on the individual level and on the national level. So there's a list of preventative diseases that obesity can cause, including type 2 diabetes, cardiovascular disease, stroke, high blood pressure, arthritis, and metabolic diseases. In regards to healthcare, there is a 36% increase in inpatient and outpatient spending, and a 77% increase in medications. And in 2006, it was found that obese individuals were paying about $1,400 more annually, which is a 42% increase than someone of average weight. And in 2006, it cost the U.S. economy $117 billion, with $61 billion in direct medical costs. So what causes this? What is making people get bigger, leading to obesity? So it's recommended that Americans get 150 minutes of moderate intensity exercise per week, but we're just not getting that. And according to Kemmler and his colleagues, the number one excuse for inactivity is lack of time. So I took that and came up with a study: which training method helps overweight and obese individuals lose weight faster? Does the benefit of the time effectiveness of high-intensity interval training help people lose weight faster than moderate-intensity endurance training? So if that's the number one excuse, people don't have time, let's see if a shorter workout, maybe with a higher intensity, can burn more calories. Looking at definitions, moderate-intensity endurance training, you're generally working out at 50 to 70% of your max heart rate. And max heart rate we get by taking the number 220 minus your age. So if you're 40 years old, your max heart rate is going to be 180. And so 50% of that is 90, and then 70% is 126. So you would want to be working out in between 90 and 126 beats per minute. It keeps the heart rate up for long periods of time, and there's a lower injury rate with it. When we look at high-intensity interval training, Heinrich and colleagues say that it combines aerobic and resistance exercises with focus on functional movements. And other definitions include that it has repeated bouts of short duration, high-intensity exercise intervals mixed with lower periods of active recovery. And during those high-intensity intervals, you want to be at 70 to 85% of your max heart rate. So again, if you're 40 years old, your max heart rate's 180, you'd be working out between 126 and 153 beats per minute. So my hypothesis is that the high intensity interval training program will lead to faster weight results than the moderate endurance program in the 2 months. So what does past literature have to say about this? I looked at low versus moderate versus high intensity training. Overall, high intensity has a greater effect than moderate intensity training on weight loss, lean body mass, reduction in blood pressure, and enjoyment, though there were some conflicting results in that. Past studies not only looked at weight loss, but they looked at change in lipids, blood pressure, glycemic response, and cardiometabolic risk factors. Nebo and colleagues studied the effectiveness of brief interval training as exercise intervention for promoting health. They evaluated potential benefits about common interventions such as prolonged exercise and strength training. 36 untrained men were split up into 4 groups. One was a high-intensity interval running group that lasted for 40 minutes per week. Second group was a prolonged running group lasting for 150 minutes per week. Another was just a strength training group lasting for 150 minutes per week. And then they had a control group that did no physical activity at all. And they exercised for 3 sessions per week. So with this study in terms of weight loss, they found that there was a greater weight loss with the moderate intensity group. Although this shows the moderate intensity group losing more than the high intensity group, I believe that they just didn't exercise long enough for the high intensity group. They maybe needed to add more minutes to their weekly sessions in order to get more adequate results. So Paoli and his colleagues studied high-intensity interval versus moderate-intensity training methods, looked at the effects on the change in lipids, blood pressure, and weight loss. They used 55 to 70-year-olds with a BMI of less than 25. And in terms of weight loss, they found that there was a greater weight and fat loss with the high-intensity circuit training. The high-intensity group also showed greater reductions in body fat percentage. Little and colleagues studied postprandial glucose control following an acute bout of high-intensity training versus continuous moderate-intensity training. And they took 10 inactive, obese, and overweight individuals. A major finding was that a single session of high-intensity training session improved postprandial glucose glycemia in overweight and obese adults for the 24 hours following a single training session, and the overall effects were greater and lasted into the next day. Kemmler and colleagues studied high versus moderate intensity running exercises and its impact on cardiometabolic risk factors. They had 81 healthy, untrained men, ages 30 to 50. For this one, they were in their exercise sessions for 16 weeks, and they found that weight was significantly lowered in both groups, but the difference was actually higher in the moderate intensity group for this one. Taylor and colleagues studied moderate versus high intensity exercise training, looking at physical fitness and function in people with type 2 diabetes. They took 21 people from a university campus and put them into the 2 groups and found that both groups showed improvements in physical fitness and function, but there wasn't any significant differences between the 2. Benda and colleagues had 12 weeks of continuous training versus high-intensity interval training, looking at if it was effective and practical for heart failure patients. So they took 24 patients ages 57 to 73. They separated them into 2 groups for 12 weeks. And in regard to physical fitness, they also did not find a significant difference between the 2. Heinrich and colleagues studied high-intensity functional training program versus moderate-intensity aerobic and resistance training program. They looked at exercise initiation, enjoyment, adherence, and intentions among physically inactive, overweight, and obese adults. They took 23 inactive, overweight, and obese adults, and they had them exercising for 3 times per week. At the end of the study, they reported that the moderate intensity group had lower exercise enjoyment than the high intensity group. So the high intensity group enjoyed their sessions more and looked forward to them more than that moderate intensity group. In regards to weight loss or BMI, they did find significant reductions in both, but there were no significant differences. The high intensity group had slightly more, but nothing significant. So switching gears, we're going to look at my study. So when we look at the methods of my study, we will have 80 people aged 30 to 50 volunteering for the study, or we'll recruit them for the study. Getting the word out, we'll put ads in grocery stores, in the malls, outside offices. We'll also enlist the help of radio DJs to announce it on the radio, get the word out that way. Inclusion criteria, we want a BMI between 25 and 40, and we want low to no activity level, so that would include less than 30 minutes of moderate intensity per week. Exclusion criteria, no known cardiovascular disease, diabetes, pulmonary disease, orthopedic ailments, or other limiting physical or cognitive impairments. So the procedures, we'll have everyone sign a consent form talking about the purpose of the study and the possible risks and benefits of it. We'll take baseline measurements, height, weight, BMI, max heart rate, and percentages of max heart rate to determine what they should be exercising at depending on which group they would be put into. Questionnaire about physical activity levels. And before the start, participants will undergo a basic training protocol. So we'll just have them walking and stretching 2 to 3 times a week for the 4 weeks prior to the program, just to get their bodies acclimated and lower that injury risk. So here's what the moderate intensity interval training group will do. They'll warm up for 5 minutes on the treadmill. They will stay on the treadmill for 45 minutes after that and work out at a moderate intensity. The cool down, 5 minutes of walking and light stretching after that, just to get that heart rate down. The high intensity interval training group, they'll also warm up on the treadmill at 5 minutes, moderate intensity. The workout we'll get into in a second, and they'll also do a cool down of 5 minutes of walking and light stretching. So the workout for the high intensity group, they're going to go through a series of 5 body weight movements. They're going to complete this series for a total of 3 rounds. And in between each body weight exercise, they're going to rest for 20 seconds. And at the end of each round, they're going to rest for 1 minute. So they would start with squats, rest for 20 seconds. Sit-ups, rest for 20 seconds. Push-ups, lunges, pull-ups, and keep going and doing that. Now for push-ups and pull-ups, there will be modifications. We will explain to the participants and give them a handout in the beginning that shows different modifications and alternatives if they cannot do those. They'll all be working out at 70 to 85% of their max heart rate. That's the goal. And for the first 2 weeks, they'll do 10 reps for each one, and then we'll increase it by 2 every week until the program is done. And then we'll repeat the measurements after the first month and after the second month, so we want to track their progress. And then they'll complete an exit questionnaire. So just as a summary of the procedures, recruitment is at the beginning. We'll recruit the subjects. We'll gather their baseline data, separate them into 2 groups, either the high intensity interval training group or the moderate intensity endurance group. After 1 month, we'll gather their data, they'll continue working out, and we'll get their final data at the end of the 2-month program. So weight and height measurements. We'll use an electronic scale measuring body weight in both pounds and kilograms. A tape measure will be taped vertically to the wall to measure height in both inches and in centimeters. And again, BMI, the body mass index, is weight in kilograms divided by height in meters squared. So that's how we would get the BMI. If you're not into math or calculations, you can always look up a handy chart online. Here's an example. You have your height, you have your weight, and you find which category you would fall into. Max heart rate, which we talked about a little earlier. 220 minus your age is your max heart rate. So if your age is 30, 220 minus 30, your max heart rate is 190. And then how are we going to look at all of this information? We're going to put it into a data spreadsheet. We're going to look at weight and BMI at different stages of the program, the baseline, 1 month in and 2 months in. And we're going to calculate the mean and the standard deviation. Here's an example of a table that we would use in order to compare the weight. These are just examples, but we have the participants, baseline weight, 1 month into the program weight, change in weight from the baseline to the end of month 1, 2 months into program, change in weight from the end of month 1 to the end of month 2, and the total change in weight. And we've calculated the mean and the standard deviation. Same thing goes for BMI. As far as statistical techniques, we'll set the significance level at 5%. The anticipated mean difference in weight loss is 1%. The anticipated standard deviation is 1.5%. The power is set at 0.80. 35 subjects per group are needed for adequate power. So we would recruit 40 subjects per group in order to account for attrition and maintain adequate power. An independent t-test will be used for statistical analysis, and the p-value will be determined with statistical software. And finally, looking at the limitations and delimitations of the study, one limitation is diet change. So as people start exercising and becoming healthier, they might inadvertently or intentionally change their diet. They might start feeling good and want to change other aspects of their diet. We would tell them in the beginning, don't change anything about your diet, because we want to see which exercise program helps them lose weight, not other factors. BMI misclassification. Measurement of BMI cannot distinguish fat mass from lean mass, and therefore misqualifies some people as being overweight, according to Strum. So if someone has a BMI of 25, but they're really muscular, this doesn't necessarily mean they're overweight. So it's hard distinguishing fat mass from lean mass. And so we would say in the beginning on the advertisements that this is a weight loss program, and if you have a BMI of 25, it's only if you are overweight and want to lose weight. The delimitations, the study lasts for 2 months, so one group may lose weight faster than the other, but is it sustainable in the long run? So, let's say the high intensity group does lose weight faster, can they keep that up and continue to lose that weight? And also the diets are not the same. So if everyone's put on the same diet, then we're not going to know whether the weight loss is from the diet or from the exercises. So again, we would make sure everyone keeps their same diet. And to summarize, my study aims to prove that high intensity interval training is more effective at weight loss than moderate intensity endurance training. And here are my references. Thank you for listening.